Hello, my name is Charlotte Kitler, and I'm a volunteer educator with the Senior Medicare Patrol, the SMP, at CARIE, the Center for Advocacy for the Rights and Interests of the Elderly. The SMP is a national initiative dedicated to curbing fraud and abuse in Medicare and Medicaid. Medicare estimates that $60 to $90 billion, that's billion with a B, is lost each year due to fraud, waste, and abuse. Volunteers teach their peers, other Medicare beneficiaries, how to spot potential fraud and how to protect themselves. As the number of people and communities affected by the coronavirus pandemic grows, so do the scams associated with it. Scammers use public health emergencies as opportunities for new fraud schemes. And because older adults are at greater risk for serious illness from COVID-19, they may target older populations. I'm here to help you guard against fraud and scams. Fraud is a crime. It is deceit. Medicare fraud consists of deliberately seeking payment from Medicare for services or products which were never provided, or for more than actually given, such as billing twice for a single service, or billing for surgical removal of a nail when toenails were just trimmed. There are things Medicare beneficiaries can do to stem the losses from fraud, errors, and abuse. 3 things: protect, detect, report. Protect your health care and personal information. Detect scams by understanding how they work. Report scams if you think you've become a victim. Protect your Medicare number. Treat it like gold. Protect your sensitive information by only sharing it with a trusted healthcare provider. Protection of your Medicare number is very important. Getting the number is the key to the fraud, and there are many ways fraudsters try to obtain it. Many of the scams have a common element: free things. Products such as leg and back braces and genetic testing kits have been pushed by telemarketers as being free. Many of the products are bogus, and many others turn out to be useless. Be aware of anyone offering free products or requesting personal information via phone calls, text messages, emails, on social media, or in person. Don't be afraid to hang up the phone or shut the door on someone who is trying to scam you. Remember, it's shrewd to be rude. Detect Medicare fraud, errors, or abuse by keeping personal records and reviewing billing statements. Read your Medicare summary notices or explanation of benefits. Act like a detective when you get your statements about Medicare payments. Go over the items on the statements to see whether they match with your own records of your appointments and services. If there are any discrepancies, call the doctor's office or the provider to see if a mistake was made on their part. The COVID-19 pandemic has produced a new wave of scams to steal your personal information. Be alert to anyone selling fraudulent health products. There is currently no cure, no vaccine for COVID-19. Be aware of companies selling essential supplies but not delivering them. Be aware of anyone falsely claiming to represent government agencies or health organizations. And be aware of fake charities. Make sure to research an organization before donating. Reporting fraud or scams to the appropriate agencies can help stop scammers in their tracks and further safeguard against malicious individuals or entities. To report Medicare and COVID-19 fraud and scams, please call CARIE at 1-800-356-3606, Medicare at 1-800-633-4227, the National Center for Disaster Fraud Hotline at 1-866-720-5721, or contact local law enforcement. Remember, protect, detect, report. Prevent fraud by guarding your Medicare number. Detect fraud by carefully examining your Medicare statements, and report any suspicious items. Everyone can play a part in putting an end to Medicare fraud. For more information or assistance, please contact CARIE toll-free at 1-800-356-3606. Help is always free and confidential. Thank you, and stay safe.